All right, so just to finish up task 4, which is just performing a leukocyte differential, I just have a couple of pictures that I printed out from the internet that I thought were pretty cool. First one I'm going to show you is more of a cartoonish looking drawing of all the white blood cells, and then the second page I'm going to show you is more of what you'll see on actual microscope when you're looking at an actual blood smear. So I'm just going to come over here and kind of go over everything real quick. So the first one again looks more cartoonish. So these are all your white blood cells. You have your neutrophil, your eosinophil, your basophil, your monocyte, and your lymphocyte. So I thought that was a pretty cool drawing of all your different white blood cells. But I kind of like this one a little bit more because it's more realistic of what you would see on an actual blood smear. So your white blood cells, we'll start over on the left over here. So you have your neutrophils right here. Try to do a little bit of a close-up. So your neutrophils, so those are your most common white blood cells that are going to be seen typically on your slide, usually indicative of infection or trauma. All right, moving on, we have your eosinophils and your basophils. That's these two guys right here. Those are typically seen together on slides, and they are usually indicated in large numbers when there are parasitic infections, when someone's having an allergic reaction. Sometimes if someone has some cancer, you can, unfortunately see those in cancer patients as well, excuse me. Moving on over here, you have your lymphocyte. So lymphocytes are typically seen when there are viral and bacterial infections. And again, that one can sometimes be seen with cancer patients as well. Moving on over here, you have your monocyte. Monocyte is usually due to chronic infections. So if a patient's had a chronic infection, you're probably going to see a bunch of monocytes on their slide. Down here is just an example of some platelets. Sometimes they're a little bigger, sometimes they're a little smaller. Your other one over here is your band neutrophil. Those are your immature white blood cells. Your immature neutrophil white blood cells, excuse me. So they have like a little band looking thing, hence the name band neutrophil. Again, they're your immature white blood cells. So when you see those increased numbers, they're usually the first responders to anything when there's an infection or anything going on that shouldn't in the body. So if you see an increased number of band neutrophils, probably because they're one of the first responders. Over here, it's just some hypersegmented neutrophil. So I thought that was kind of a cool picture. Down here is just an example of just more platelets. Over here is a Dole body. Pretty rare. I haven't really seen too many on slides. And then over here is just the difference kind of between a white blood cell with a canine and a feline. So I thought that was kind of cool too. All right. So again, those are just some pictures of what white blood cells look like. And that completes task 4, which is just performing a leukocyte differential.